The University Health Network is one of the largest teaching hospitals in Canada. It's located in Toronto. It's a multi-site teaching organization which provides a variety of specialty care services. And our group is positioned within the Center for Innovation in Complex Care.
Our product is Clinical Message, and it is a system to help improve communication between healthcare providers, ultimately trying to improve the care of the patient. And it's used regularly at our institution on our internal medicine wards to communicate critical information that is time sensitive, that needs to get to the providers, and a step above the previous communication methods that we used to be using.
One of the major goals of this initiative is to address issues around patient safety and quality of care. Based on experience within our organization and the literature worldwide, the majority of patient safety errors and incidents are related to issues around communication between and among healthcare providers.
One of the other innovative concept in this whole solution is that while technology is great, is the individual human behavior is a much bigger thing. So the idea is to how do you help modify human behavior by providing new technologies and techniques to them? And that's what the whole idea of learning organization. How do you engage individuals in coming up with innovative ideas, not only putting innovative ideas forward, but taking those innovative ideas and making them practical. So that's another big component of it, creating a learning organization and providing real-time feedback to not only practitioners, but also patients. So therefore, everybody feels the evidence of what they did, how it improved patient safety and quality of care.
The focus of this initiative was around the general internal medicine service. And the reason we looked at that service is because it's among the most complex services. The acuity of patient care, the complexity of care has steadily increased over time as patients become older and have more illnesses that are being managed. We're also more frequently managing patients across multiple sites in the continuum of care. So communication becomes increasingly important. We provide care. We certainly have innovative ideas and we can contribute to the process, but it's only through partnerships with industry that we can actually come up with solutions that'll be scalable and can apply to different clinical situations. So one of the opportunities obviously is to come here with an industry partner such as QRS. The other is to engage with other groups and other industry partners looking at other solutions both within healthcare and other verticals to see how we can look at even broader ways of addressing these challenges.
One of the conversations that discussions have been having in the industry is having a system design thinking, holistic view of the problem as opposed to a very micro view of what the problem is. So when you take a step back and you look at this fundamental problem of issues in healthcare, such as the delivery of care, where all the innovation is being focused on now, by looking at system design thinking, and that's what we applied to this solution. And that revolutionary thought process is that made it simpler to define the problem, and then even the solution to that problem became so elegant. Just the design principles that everybody talks about in the industry now.
I think having a system in place, Clinical Message, that clinicians use on a regular basis to communicate back and forth, it's enabled us to actually do a lot more by providing dashboards on how they communicate, but also trying to standardize the processes using scorecards or things like checklists to actually try to further improve care.